And good morning, everyone. Today is the first lesson, the Nursing Assistant in Long-Term Care, Chapter 1 of your textbook. And I'm very excited to say we have new textbooks that I'm going to be teaching out of. So I think what I'm going to plan to do is just to kind of zip through this PowerPoint, give you some highlights of things that you need to read in your textbook. There's going to be some questions along the way, and hopefully it will be some information that will kind of trigger all of the important points in the chapter. I've done this a couple of times, and the first time I did it, took me about an hour to do the lesson, and I'm like, nah, we don't want to do that. So too long, and you don't want to listen to me ramble on for that long. So let's take a look at the PowerPoint just real quickly, and we'll discuss it more when we have our Google Meet, our first Google Meet when we have lessons. So first of all, long-term care facilities. Discover what that is. Talk to me about what that is and read and learn what that is. What are some other names for long-term care facilities? What exactly is a long-term care facility? Following terms. There are going to be a lot of terms throughout all of our lessons, throughout all of the textbook. And the beginning of each chapter is a list of vocabulary terms. It is really important that you take a look at those. There are lots of them that you're going to be using throughout your medical careers. If you choose a medical path, if you are a CNA and you just want to go on, or if you're CNA and you want this to do either as a career or as a job currently, it's a nice, good paying job, you're going to need to know these terms. So take a look at those. Long-term care, skilled care, chronic, acute, and the resident. We call people who are in the nursing homes, long-term care facilities, skilled nursing facilities, we call them residents. It is their home. It's the place where they live, as a, excuse me, as opposed to patients, which we refer to in hospitals or doctor's offices or short-term care. Okay. Again, talking about somebody living in their home, and how would you feel if somebody came into your home and moved things around without permission? More terms, please take a look at all of these. I might be assigning individual terms for people to share out in the classroom, Google Classroom, when we meet in Google Meet. So take a look at these terms. Here are just some pictures that identify the different long-term care facilities. This is a picture of the Kensington downtown. Kensington is known as an assisted living facility. So find out read in your chapter and find out what an assisted living facility is. Here's some home health care. A CNA is checking a blood pressure. It looks like in a lady's home. Intergenerational care or occupational therapy, it looks like maybe, or an activity director, maybe doing something there. Sandwich generation. Interesting situation. A lot of families are in that position right now, a sandwich generation, where there is a person, a wife, a husband, or a family that is taking care of little bitty children, and then they're also taking care of their older adults. A hospital, of course, is acute care. So what is acute care? Find out what that term is. And then intergenerational care. This is care where we are mixing generations in the care facility. So a group of preschoolers might come in and play games with a group of residents. Rehab, very popular. We have Bounce Back at Seminary. It's a rehab center. Residents are going to go. They're going to stay in the facility, but they're going to get really intense physical therapy. That happens at Bounce Back. Outpatient, you just do that. You walk in, you get your care, and you go home that day. It's not an inpatient stay. Hospitals are for inpatient stay. Just some more pictures here. Pet therapy, another term to look at and to understand. Medicare and Medicaid. What is Medicare and Medicaid? So a couple of things there. You can read through the slide, but what I want you to remember about Medicare and Medicaid is Medicare is for people of 65 years and older, or if they are disabled and cannot work. 65 years or older, disabled, and cannot work. Also, Medicare is a federal agency payer source. Both Medicare and Medicaid are payer sources for people. Medicaid is at the state level, and it's for low income. It's based on financial and income and special circumstances. So Medicare, federal, 65 and older or disabled and cannot work. Medicaid is at the state level. It is based on income for low income people, and it is based on income and special circumstances. Here's just some statistics. 88% or older are over the age of 65. 71% are female, 85 are white, and a third come from private residence, 64% come from the hospital. So think about that statistic. 6 out of every 10 people that are admitted to the hospital end up in a skilled nursing facility. So do you understand now maybe why people don't want to go to the hospital? My mom fights it quite a little bit. She's been needed to go to the emergency room because of a fall that she's had, and she doesn't want to go because she's afraid that she's going to end up in a nursing home. So take a look at those statistics. I'm going to ask you a question about that as well. Some more terms: length of stay, dementia. Understand and know what dementia is. Nursing assistant, activities of daily living. We're going to talk a little bit more about that when we get together for our Google Meet and our lesson. Some of the things that you are expected to do, maybe you know, maybe you don't know what nursing assistants are expected to do. Take a look at that. I want you to tell me what several things are that you're going to do as a nursing assistant. Some more things that you're going to do. Here are some videos that if you want to go to and watch those videos, they would be good ones to watch. What it's like to be a CNA. Things you're not going to do: give medicines, insert tubes, do anything with tubes, remove tubes, flush tubes, anything with tubes, change sterile dressings. You are not going to do that. These are tasks you will not do and you do not perform. They are not in your scope of practice. So as a nursing assistant, we are considered a professional. So how are we going to behave as a professional? And exactly what is professional behavior? It's the way we are going to behave and act in a certain professional setting. A waitress at a restaurant isn't going to dress, behave, or act the same way that a nurse does, or a teacher does, or someone who welds, someone who builds things. So we all have an expected professional behavior. So what are some things here? You can read through the list, and I'm going to put this PowerPoint up also on Google Classroom so you can look at it as well. So some of the things just to talk about: you're not going to leave work early. Don't report under the influence of alcohol or drugs. Keep a positive attitude. Dress neatly. Be polite. Be honest. Do not curse. So on and so forth. If you don't understand something, you're going to ask questions. Again, be honest. I can't impress to you enough the importance of honesty. If you tell the truth, you don't have to remember anything. The truth speaks for itself. Be honest and document carefully. Accept constructive criticism. We're going to talk about that in future lessons, but it is really important to understand when people are giving you constructive criticism, correcting you if you are doing something wrong. That's okay, and it should be done in a positive and a very constructive, uplifting and educational manner. It should not be mean-spirited. It should not be meant to humiliate, but it is meant to correct and learn. Keep in mind, in the medical profession, we are taking care of people and we have lives in our hands. So it is important that we do things the right way and that we are doing things to keep people safe and keep people healthy. One of the things we can't do as caregivers, nurses, CNAs, doctors, we can't accept gifts or tips. We can in no circumstances accept money. We cannot accept gifts, especially expensive gifts. A lot of these residents are confused. They don't know, remember or know what they were doing. Now, that doesn't mean if they offer you a cookie or a piece of candy or they've got a candy jar. Lots of residents have candy jars or cookies that family will bring into them. That if they offer you that and you will want to take a cookie, that's fine. If they offer you money, however, you need to say no, thank you. That's it's very kind of you, but I get paid well. I'm not allowed to accept gifts. Be loyal to your facility. Be a good role model. Other qualities: patience and understanding. Patience, patience, patience. You're going to hear that a lot as a CNA and as we go through. We can do things a lot quicker and a lot easier than the residents can. They struggle buttoning their shirts. They struggle brushing their teeth. They struggle feeding themselves. Honest and trustworthy, again, conscientious, enthusiastic, courteous, and respectful. We want to make a good impression. I think these are some common sense things. You can take a peek at them. Keep your uniform clean and neat, bathe, wear deodorant, brush your teeth, avoid strong scented smells or strong scented items. Some people, coworkers and also residents and visitors, they can be very offended by strong smells, strong perfumes. So be careful about that. Hair is to be neatly tied back. Girls, make sure your beards are trimmed. Just checking to see if you're listening. Guys, don't apply that makeup too heavily. I'm just kidding. But makeup should be light or none at all. You're not going to wear the same clothes, the same jewelry, the same hairstyle, the same makeup at a wedding as you would as you are a professional, a nurse or a CNA or a teacher or whatever that profession might be. Of course, keep shoes clean and wear as little jewelry as possible. You will be responsible for always having your name tag with you or identification badge. We'll talk a little bit more about that when we get to clinical. Be empathetic. What does that mean? Dependable and responsible, humble and open to growth, tolerant and unprejudiced, of course. So understanding how it is to be professional is a key step for the nursing process. So, care team, you are a CNA at a facility. You are one of many disciplines on a care team. So who is on the care team? Who can you think of that is on the care team? And we'll ask a little bit of a question for that one as well. Here are some examples of members of the care team as we're going to be talking about, and some more examples of members of the care team as we are talking about. And again, members of the care team. A little bit about nursing in the long-term care facility. In any institution or any hospital, medical profession, or any medical entity, I should say, we're going to have what we call a chain of command. Somebody's going to be at the top of that and is going to be in charge. Here in our school district, we have somebody that's at the top of the chain and then has directions all the way down. Our school board is actually at the top of our chain. They're actually our bosses and in charge of everything. They then a Dr. Asplin superintendent, then it goes down to the assistant superintendents, building principals, staff, so on and so forth, teachers, teachers' aides, so on and so forth. Same with the medical profession. We have a chain of command. In healthcare facilities, in healthcare institutions, we have got what we call nursing services. The nursing services are just that. They are responsible for the nurses and the employees under the nursing services umbrella. So at the top of that list or that chain would be the director of nurses. Short, it's called the DON. She is responsible for the entire nursing staff. She is going to delegate. She is going to have nurse managers, and then the nurse managers are going to have their staff nurses, LPNs, LVNs, RNs, and then CNAs will report to them. So the nursing services is all of this all put together. There's also usually a staff development department or a nursing education department. And that department is very important in keeping us all educated and up to date on everything that we need to know in our particular facility. Those who provide the actual nursing care, of course, are registered nurses, LPNs and LVNs, and then nursing assistants. Here's an example of that chain. There's a nice picture in your textbook as well. There's lots of these illustrations in your textbook. So as you're looking through this PowerPoint, which I'm also going to post on Google Classroom, please get your textbook out and kind of take a look at that as well. So when we are talking about the chain of command and delegating, what exactly is delegation? What does that mean? That means somebody is going to give you tasks to do, and then you are going to perform them as your profession and as your scope of practice allows. So when you are delegated to do a task, you have 5 rights. Is it the right task, circumstance, the right person, the right direction, and the right supervision and evaluation? So some questions that you could ask yourself. Do I have all the information? Do I believe I can do that task? Do I have the needed supplies, etc., so on and so forth? Do you understand what you are doing? You have the right to refuse a task at any time. Is the task beyond your legal limits? Is it something you want to do? Earlier we mentioned things that a CNA does, things that a CNA doesn't do. So if the nurse comes up to you and says, hey, would you hand out these pills? You are to refuse that, and I am expecting you to refuse that. That is not in your scope of practice. It is beyond your legal limits. So that's just one example. Is it in your job description? Is it a task that could harm somebody? When we get together and discuss this lesson, remind me to tell you an experience I had with a task that could possibly harm somebody. And when I was in charge of an Alzheimer's unit, when I was working in a skilled care. So remind me to tell you that. it's really interesting as how things can go really wrong. When you know it's right, or you know it's to be done or not to be done, you can refuse. If it's against the law, of course, if the directions were unclear, or if your supervisor or your nurse isn't available to evaluate you or supervise you. For example, if you've got something that you maybe haven't done before, you know it's in your job description, but it isn't something you've maybe done at a new facility, or you just haven't done there, you have the right to be supervised and evaluated. Say, I know this is my job. I know I'm to do this. Can you supervise me when I do this, just to make sure that I'm comfortable with what's happening and what's going on. Always ask questions. If you are unsure about something, as a CNA, as a nurse, you are always to ask questions. You want to give the best care possible. And if you don't know how to do it, what could happen? What could possibly go wrong? What could the repercussions be if you are not understanding what this task is? The nursing profession, us, part of that as CNAs, the nursing profession is a holistic approach. So what does that mean? That means that we are taking care of the whole person. We are taking care of them mentally, physically, emotionally, socially. We are taking care of the whole person, not just that cut that's on their hand, but we're going to fix that cut. We are going to prepare that cut or do whatever our responsibilities are for that. Then we're going to reassure them. We're going to give them support. We are going to make sure they're socially active, that they are interacting with other people. It's really kind of a hard time right now for these skilled nursing facilities because people can't come and visit because of the pandemic. So really important that we keep that in mind. Some more terms to understand: resident-focused care, team nursing, primary nursing, and functional nursing. Make sure you look at these and understand these. We will talk a little bit more about this also in person and in our Google Meet. Here's just some pictures of some nursing, that primary nursing, one-on-one, and team nursing, so on and so forth. Policy and procedure. These are terms that you're going to need to understand as well. It's really hard for students. I'm not really sure why, but it is hard for students to understand what policy and procedure, to keep them separate or understand what they mean. So policy is the course of action. Policy is what you need to do, and procedure is the way you're going to do it. So for example, that I need to check this blood pressure. That's the policy. I'm supposed to check this blood pressure. Okay, I'm going to check that blood pressure. Now, how am I going to do that? That's the procedure. The way I do that is the procedure. And there's a very specific way to check a blood pressure correctly. The policy is, I'm going to check the blood pressure. The procedure is the way I'm going to do that. Difficult to try to keep that separate. Every facility will have manuals explaining what the policies are and then the procedure for that. So the policy and procedure manual. And when you get to a facility, you will learn where those places or where those manuals are, and so that you'll be able to get them when you need them. In the nursing facilities, long-term care facilities, we have to be regulated. So there are state and federal regulations that skilled nursing facilities have to follow. We're going to talk a little bit more about this. I believe it's tomorrow in the next lesson in chapter 2. But all facilities have to be monitored, and they go through what we call a survey process annually. Sometimes more often than that if there's a problem, but most of the time it's just annually. The facility has an inspection done, and hopefully everything is all in order and there aren't any situations or problems. If they find a problem, if the surveyor finds a problem, then the facility could be what we call cited. They could be cited or given a deficiency or given a tag. There's several different terms that go along with a survey. Surveys are done once a year in the state of Illinois by the Illinois Department of Public Health. And if those surveys, they find problems, they find citations, they give the facility a tag, there's a process that they have to go through to correct those problems. So for example, if they come in and they see that the refrigerator temperatures aren't consistently at 38, that there's one day they were 42 and one day they were 35, they will give them a citation and say, you've got a problem with your refrigerator, you're going to need to fix this. You will have 30 days. We'll come back in 30 days and we'll want to check your temperature log again and make sure it's okay. Probably not going to be a fine, probably not going to be a big deal. However, If it's a bigger deal, if they are finding that there are residents complaining that there's abuse going on a lot, then they could be fined a large amount of money. So we can talk a little bit more about that when we get into some of the rights and responsibilities of residents, which we'll talk about when we talk about Chapter 2. I think I've talked a little bit, enough about the inspections. If you get asked a question by a surveyor, and when you are a CNA working in a facility, you will no doubt be a part of this survey process. And if you get asked a question by a surveyor, it can be very stressful. Everybody gets very stressed because we want it to be just right. We don't want to get in trouble, so to speak. We don't want to have citations and problems, but you always want to answer it honestly and to the best of your ability. If you don't know the answer, what are you going to do? Make it up? No. So if you don't know the answer, you're simply going to say, I don't know the answer to that, but I'm going to find out for you. I'll go talk to my supervisor, the director of nursing, my teacher, whatever that might be. Always answer honestly. And to the best of your ability. Joint Commission is another non-for-profit organization who focuses on standardized improving in quality and safety for facilities, but this is pretty much for hospitals, and their surveys are separate from the state inspections. I don't know any skilled nursing facilities that worry about Joint Commission. That is done with hospitals. All agencies have to meet the standards so they can become licensed, certified, and accredited. Those three things need to happen in order for them to stay in business. So it's really important that they do that. Okay, so that is a really quick overview of the lesson from Chapter 1. And so what I'm going to do now is just stop right there, and we're going to do this with an Edpuzzle, and then please be looking at your textbook and have any questions, and so we can talk intelligently and be informed when we meet in our Google Meet to discuss the lesson. All right, thank you.